Okay, we are live. So everyone, I call this meeting to order. It's 8:37. The meeting is for the Anne Arundel, tongue-tied this morning, the Anne Arundel County House Delegation meeting. Thank you everyone for being here. We are going to start with the Pledge of Allegiance and prayer by Delegate Saab. We have the flag and it is your pleasure if you wish to stand. Delegate Saab.
Thank you, Madam Chairman.
Madam Chair, we're live.
Can everybody hear me?
Yes, thank you.
Okay, great, thank you. Okay, if you can stand. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And I can please bow your heads. Dearly Heavenly Father, I humbly ask your guidance, protection, and strength over all members of the Arundel County delegation. I pray for healing within our nation and that your love fills our heart. Our country is divided and in need of your guidance. Darkness cannot drive out darkness, only light can do that. Hate cannot drive out hate, only love can do that. Let us do your work as public servants. Let us not forget the true King who gave us the opportunity to serve. In your name we pray, amen. Thank you, Madam Chairman.
Thank you, Delegate Saab. That was very nice. I would like to now take a moment to have just a moment of silence in recognition of the people we have lost due to this COVID-19 pandemic and those that are suffering and fighting for their lives. Just a moment of silence, please. Thank you. So at this time, I'd like to introduce our guests, and I am excited that we have such distinguished guests today. We have our county executive, Stuart Pittman, and we have Dr. K. And Dr. K, there you are. I saw you earlier. Good to see you. And I will let you pronounce your own last name because I don't want to mess it up. We also have our newly appointed Chief of Police for Anne Arundel County, Dr. Amal Awid. Yep, and we have our Fire Chief returning to us, who we're always happy to see, Chief Tricia Wolford. Okay. So I think I've gotten everyone. I don't know if we have any other representatives, but if we do, if I missed you, please wave your hand and I'll be more than happy to introduce you. It's a little bit different. I can't see you sitting in the crowd as we do when we're in person. Oh, Pam Jordan, good to see you, Pam. So Pam Jordan is here from the department. Now I'm probably gonna get it wrong. I'm probably gonna say the Department of Aging, and you're actually now in a new position. And Pam, if you would unmute yourself and just give me your position again.
Good morning. Great to be here. I am the Deputy Chief Administrative Officer for Health and Human Services for County Executive Stuart Pittman.
Thank you, Pam. I appreciate that.
Thank you.
Great. So we are all here. I'd like to make a special introduction to Matt Carpenter. Some of you may not have met him yet, but Matt is counsel from Department of Legislative Services. He is here with us and he has been awesome, an awesome assistant, and he will continue to do great work. We all miss Kathy Saley, but Kathy has retired, and happy wishes to her. So we're going to move on. The first thing we have on our agenda is to talk about our rules. So we have the 2020 rules that were adopted January 10, 2020. We would like, if you would take a look at those, that would be great, because we will have on January 29th at our next meeting, we will be adopting our rules. We also have the Anne Arundel County delegation procedures dated 2019 for adoption. So at this time, I'd like to entertain if we have any motions for any changes to the rules or to the procedures.
Good morning, Madam Chair and members of the delegation. I do have a motion with respect to the rules under section 13 where it talks about the minutes. As we are operating under a new environment, so to speak, I'd like to move that we add under minutes where it says that the chairman shall designate a staff member to record the meetings and maintain tapes for delegation use. The tape shall be available to the public, and this is where this is the add and archived for at least 5 years.
Thank you.
Is there a second?
Thank you. It's been properly moved. Is there a second?
Second.
Thank you. So it's been properly moved by Delegate Rogers and seconded by Delegate Shanika Henson to amend the rules to indicate that the recordings will be kept for 5 years. Is there any discussion on this motion? Okay, so we will, so if there is no discussion and there is no opposition, we will, I believe, Matt, and you can please, unfortunately, I can't whisper over to your ear and I really hate that, but I believe we would vote on that particular change. And then when we come back next week, we will vote with respect to all changes, or should we hold this change in abeyance until next week?
We can vote on this change now and then adopt the rules as a whole next week.
Thank you very much. So at this time, we will have a roll call vote on the change that has been proposed. Secretary, please call a roll call vote. Now, mind you, our secretary is having so many duties this morning. So if there's a little bit of delay, keep in mind, please, all the various duties that she has this morning. We don't get to have our snacks, but boy, are we keeping her busy. Deanna, if you could hear me, could you initiate a roll call vote?
Madam Chair, it sounds like there's not opposition to this move. If it pleases the chair, we could just vote by affirmation, yeas and nays.
Thank you, Delegate Kipke. I would accept that. So if we could just approve, since there is no opposition, we will go ahead and approve this change. We will make that adoption of all the rules if you have a moment. If you have the opportunity to review the rules between now and next week, it will be greatly appreciated. And we will entertain a motion for adoption next week. Thank you. Okay, moving right along, let's talk about snacks. I brought that up very briefly. So let's talk about snacks. So since we don't have our dues that we would normally dedicate to having our morning snacks, it was suggested that if delegates are so inclined to, instead of paying dues for snacks, that you make a dedication or a donation to the Arundel Food Bank on behalf of the delegation. So I'd like to know if that is something that you all want to do as a body, or would you prefer to, if you want, you can make individual donations, but I don't believe there's anything that would prohibit us as a delegation from making that donation.
Madam Chair, if I may,
Yes, please.
I think we should do it together. I think that's symbolic on many levels. So that's my suggestion, that we would do it together.
Great. Thank you, Delegate Howard. Are there any other comments?
Madam Chair,
Delegate Carey.
I agree with Delegate Howard. I think it would look, I think we should do it together.
Sounds good. It sounds good. Thank you, Delegate Carey. Any other comments in that regard? Okay, great. Now, I think what Delegate Lehman, did you want to say something?
Yes, I was gonna, I hope I'm not stepping on your toes here, but I was wondering if you could explain, I love that idea of us going in on it together. I think it, makes a bigger, stronger statement, but how will we go about that?
Well, what we would do is just our dues would be collected, and we would issue one particular, one large, well, not large, but one check to the food bank, and we would state that it is on behalf of the delegation.
Great. And can you remind us of the amount?
I cannot at this particular moment because I don't know the amount, but I certainly will share that in our through email. Yep, I will share it.
Okay, thank you.
Usually I believe is depending on the need. So what I'll probably do is we'll probably end up taking some level of an average of what we've, there we go. Thank you, Sienna. So it's $55.
Okay.
Okay. So I can't, oh, there's Matt. I was going to say, I can't see Matt. I always feel more comfortable when I can see Matt. I will entertain a motion for each member to give $55 so that we can have a collective donation to the Anne Arundel Food Bank.
Second.
So move.
Thank you. So is there a second? I did hear a second from Delegate Howard. Okay, thank you. Are there any objections? I didn't hear any objections during the discussion. Are there any objections? Great. So I don't believe we're going to take a roll call vote. We will also move with consent on this one as well, that we are all in, it seems like we're all agree with this one. Okay, great. So that's what we shall do. Wonderful. Now let's get on to our guests. So first up, we have our County Executive, Stuart Pittman. And thank you, Mr. County Executive, for being here this morning. One good thing about having a few things that we wanted to take care of, it gave us opportunity to open up the live stream and work out the kinks before you started presenting. So thank you very much for being here, and we look forward to hearing your presentation today. And keep in mind, members, that today we are focusing the presentation on COVID-19. Next week, County Exec is kind enough to return, and we will be focusing more in lines of the usual legislative presentation that we have from the County Exec. Okay, great. Mr. County Executive.
Thank you, Chairwoman Bartlett. That's very appropriate. I feel like in government right now, we're doing two jobs. One is COVID and one is everything else. So I appreciate the opportunity to come twice. And thank you, Vice Chair Rogers, as well, and the whole delegation. I feel like Team Anne Arundel is back together, and that's an exciting time every year when you all go to Annapolis or stay in Annapolis, as the case may be, and make sure we get all the good work done that needs to get done, and kill all the bad bills as well. So I'm not going to talk about legislation. I'm going to talk about COVID and the county's response. I have been briefing you as we go before session started. So I'm not going to repeat things that we've already talked about. I'm going to give you sort of an update for right now. But then we also, I'm thrilled that we have Dr. Kalyana Raman here to speak, as well as Chief Wolford and Chief Awad. I do want to note that Chief Wolford's got to be off of this call at 9:30. And so I will try to be brief. If I'm not brief, we might have to change the order to get her out of here. But I mean, the partnership with all of you has been great. I know that you're keeping your constituents informed, everything from testing to vaccination to encouraging them to do the hard work of making personal sacrifices to slow the spread of this virus. And it's been a roller coaster, as you all know. And we were just a few weeks ago, or a couple of weeks ago, pretty close to 60 cases per 100,000, which back when we were fighting to stay below 10 just didn't seem possible. And my biggest concern at that time, as numbers were increasing, was what I was seeing in hospitalization projections. And that's the part that I think all of us have been most concerned about. That if we had gotten to the point that the Johns Hopkins folks were projecting in our hospitals, we would have been in serious trouble. But the great news right now is that we are holding at about 150 to 160 COVID patients that are hospitalized at our two hospitals in the county. Between them, we've got about 600 beds, so 636 beds. And so that's a significant strain on them to have those extra 150, but it's a strain that they can certainly manage. And what they've done is they've added beds, they've added ICU beds, moved them into emergency room. They've added staff. It's a tough time for them, but the great news is that the projections now look like we're pretty close to the peak. They're saying the peak in hospitalizations is early February, and then they're expected to drop. Our numbers have dropped recently. We've got through the holiday bump, and we're back down at about 45. Puts us about 10th in the state among counties. But it's been an up and down struggle. You know, we have Annapolis during the summer, and people come to Annapolis and party, and it's been. I kept hoping, and Dr. K kept hoping, that because we were the county that had really nailed the contact tracing from day one, that we would have much lower rates than everybody. And we got there for a few weeks, but we haven't been able to stay there. So we have to keep the hard work going. You mentioned we had our moment of silence, and we sometimes forget about the actual deaths in our county. And it was early December that we were at 300 when we lit the Christmas tree in Glen Burnie Town Center and had a moment of silence. And here we are now at 432, if you include the 14 who were not tested. So that's 132 more lives lost just in that short time. The fact that the numbers are peaked, it seems, and that we think that the hospitalizations are going to drop means that we can start once again thinking about reopening our economy, getting our restaurants back to 50%, getting everything back to the level that the state, that the governor requires us to be at, not go above that, and most importantly, get our schools open. So I was thrilled that our health department all along has said how important schools are, and that we can start increasing we can manage with a higher case rate and have schools open based on the science, based on what the research is showing around the country, and based on the fact that we have vaccinations that are happening. So the governor talked about that yesterday. We were thrilled to be right in line with what the state is talking about. The question about vaccinations and teachers and all school staff is an important question. And we do want our teachers to feel safe, and we want parents to know that the virus is not being spread by teachers in the schools. So we are prioritizing our school staff in our vaccination program. And I want to say something about the vaccination mobilization real quick, because I am so damn proud of what our departments have done in Anne Arundel County. Our health department has been working ungodly hours, and they've been setting up, while continuing to do the testing that is very staff intensive, and the contact tracing, which is very staff intensive. they've managed to set up these new test, these new vaccination sites. And I've been at both the Arundel Community College and then the Maryland Live, and it really is seamless the way people are coming through, and everybody's attitude is great when you talk to the people getting tested. Now, the ones who haven't gotten an appointment aren't quite as happy, and that's something that we all have to help manage, the high expectations that people have that they're going to get tested soon, when in fact it's going to take time. So we're getting about 5,000 per week from the state, and we don't know when that number is going to increase. But to put it in perspective, we've said we want to prioritize seniors of 75 and over in our 1A rollout, and we have 40,000 of them. And so that's 8 weeks right there. Not all will get tested, maybe at 7 weeks, 6 weeks, but then we also want to make sure we get our teachers vaccinated. So we're going to have to make some tough decisions, divide those up and it's going to take time. The highlights, though, are that not only has the health department done a great job of rolling out the vaccination program, but other departments as well. Aging and Disabilities has been coordinating the taking of calls for folks who, particularly the seniors who aren't great on the internet. And just last weekend, they took close to 1,000 calls, and that included staff from all over the county that we redeployed to take those calls. And I was told they were averaging 10 or 15 minutes and walking people through the process and assuring them that things were going to be okay. And so I want to thank them. And then I also want to thank our fire department, because in 1A, we had to get our first responders done, all public safety. So police, fire, detention, and Trish Wilford and her team stepped up, and they are masters at logistics. And they managed to get all of our first responders done quickly enough that we were able to announce that we could move into 1B. It turned out to be earlier in the same day that the governor encouraged everybody to move into 1B, but we were really ready to do it. And we were doing it on MLK's birthday on Monday. And that felt great to everybody. So I want to thank the fire department for making that possible. And we found that they are so good at it that now they get to do all of Anne Arundel County Public Schools. So we have 14,000 of those folks that we want to get vaccinated, and they've run the numbers. And I'm sure that Chief Wilford would talk about this in some more detail, because I've seen her very detailed plan, and they can make that happen in 7 days, those 14,000. The problem is we don't have those 14,000 vaccines. So that's where we're going to have to make the tough decisions about who gets them first. And our hope, of course, is that we understand the state is only getting their 78,000 a week. And the feds haven't really been telling us what the future looks like in terms of vaccine rollout, when they will be able to increase. We hope that the new administration will be a little bit more transparent and have a plan, let us know what the plan is, so that all local health departments and everybody who's involved in this can make their own plans for the coming weeks and the coming months. So that will be very, very helpful when that happens. Dr. K will probably talk about this too, but I can't help but share what he's told me, which is that we not only have the capacity to do what we're doing, but we have a plan that will allow us to scale up, at least double what we're doing, handle both 10,000 new every week, plus the 10,000 second doses, and even scale that up beyond that with a little bit of notice. So it means hiring a lot of new people, 120 new positions. That's well underway. And redeploying county staff from all over government. So I want to just quickly turn to the economic situation as a result of the pandemic and the work that our departments have been doing. It's been tough. I mean, the unemployment numbers and new claims have had another little bit of a spike as a result of it's been going on everywhere recently. I've been watching the numbers in Anne Arundel each week compared to the numbers in the state. We started out, we were about what our population would suggest, about 10% of the unemployment insurance claims at the beginning of the pandemic, when the big major shutdown stay-at-home order happened. And but then after 3-4 weeks, we started to slip down so that we were averaging about 6% of unemployment insurance claims in the state of Maryland. So that's a good thing. We don't know exactly why that is, but it says some good things about the resilience of our economy in Anne Arundel County. The response on the business side has been mostly managed through Economic Development Corporation and they have been creative. We have been creative with them. It's such a huge need in the business community that you feel like you're dropping drops in the ocean in terms of assistance. So we've had to target it. And the $5 million that was first rolled out for the Customer and Employee Protection Grant Program, I thought was great because it was public health. It prepared them to deal with the public health crisis. It was to do plexiglass and computer systems and delivery systems and all the things that they needed to do to adapt to this kind of an economy. And it was really appreciated and well run and rolled out quickly. Then we did $3 million in childcare grants for childcare providers. We did another $1 million for nonprofits. We did arts. We've done now over 10 million for restaurants, and we've even done some creative things with venison for our food bank. So and helping farmers on crop damage. So they have been great partners at economic development, but then all of our health and human service agencies, and this has been really managed and corralled by Pam Jordan, that's the reason she's with us to answer questions. The homeless assistance program, where we've got about 100 folks in hotels because we can't run the winter relief program. And we started that because congregate shelters couldn't keep people in who might have COVID. And that's been a really important program. The food distribution system has been, you can go online and you can see the maps of where it is and where food is being distributed. The numbers are through the roof. I won't go through them about how many meals have been distributed in all these programs, but we have our Fresh Food Friday that goes, from senior centers, and we've got our pantry on the go where seniors can get a week's worth of food. We've got our Feed Ann and Arundel through the restaurants, and we've been providing direct grant assistance to them. And where the restaurants are making the meals, and then the nonprofits and the churches and the communities putting all these out. A lot of you have been out on these food lines helping, and we appreciate that. The check-in calls from aging to seniors and folks who are stuck at home, these weekly phone calls, in some cases dailies. I understand there've been like 92,660 calls according to my most recent dashboard, and these are calls that take some time. And so we thank them for that. And then one of the things that's been difficult is getting money into the hands of people who need it the most. The low wage workers, the lowest income people in our communities and all around the country are the ones who are the most likely to have lost their jobs. And we're doing eviction prevention. We're doing help with bills and utility assistance and all the traditional programs. But we felt that we needed, especially with the slow federal response lately, to get cash in their hands, that they could make decisions about which bills to pay. And the only legal way we could figure out how to do that was $500 debit cards. Didn't have to do the tax forms because it was under 600. And that's taken some time to get figured out. But Workforce Development's done that and got out $3 million worth of those 4,280 cards. And we have another $2 million that we have dedicated to expanding, continuing that. And then, of course, Anne Arundel was really first out of the gate on eviction prevention and counseling and direct assistance to the landlords after negotiating their deals with their tenants. And that has grown. We've done about $5 million there. And the new federal money is going to get another $17 million to Anne Arundel County. So our team at Anne Arundel Community Development Services is staffing up to be able to do that counseling and do that work. So we're very appreciative there. And then, of course, there's all the mental health issues that come along with this, and mental health agencies' work they've really stepped up with crisis intervention. 21,619 calls that they have taken on their warm line, and we've got a new grief counseling program as well that we funded with CARES money. So we want to thank them, and then finally I mentioned, I could go on, and I'm sorry about this, but I'm just so proud of all the work that's being done, that we have our contact tracing operation, which is unique in our county. It's not just done through contract with the state and NORC, the phone bank folks that don't live in the county. This is done by our folks. And they find out when they talk to somebody who's tested positive what their family situation is and how they need to change their lives to be able to isolate and quarantine. And so we've linked them up with our social service folks and our partnership for children, youth, and families to deliver food and to provide whatever assistance they need to get by so that they can stay home and not work. And that's been very important as well. So we're looking forward to new federal money. I mentioned the $17 million that we will get for eviction prevention, but there's going to be for the state at least, and we can sort of, I usually figure 10% comes to us. We'll see. Sometimes we have to actually fight for it, but 385 million for testing and tracing and 76 million for vaccinations. This is to the state. Much more than that for schools. And our school system is likely to get significantly more than the 10 million that they got in the CARES Act, closer to 40 million, we believe. Some of these numbers are not final yet. But the fact that we have this assistance coming is helpful. We were careful in our CARES Act allocations to make sure that we budget in a way that we'd have a fund balance and could continue programs that need to continue, even if we didn't have any more federal assistance. So we're looking forward to having that assistance, but we are not going to stop feeding people or stop eviction prevention. There's just no way. We have to keep roofs over people's heads. We have to keep them fed and prepare them so that we can rebuild the economy from the bottom up, the actual people who do the work, and not allow them to be hurt any more than they already have. So I'm going to stop on that. My main message is I'm very proud, and I want to thank all of you. And if your question might be, before you ask it, is what can we do to help? And it's to continue to get the message out to your constituents, particularly now about vaccination, and especially try to tap down some of the expectations. We're all eager. Most people are eager. A lot of people are eager to get these vaccinations, and we're going to start trying to do a better job on messaging to let people know what the numbers actually look like. Here's the supply of vaccines. Here's the demand, and here's the plan. We're ready. We're ready. We're ready to get these vaccines into people's arms, but it will take time. So I will stop with that.
Well, thank you, Mr. County Exec. We have some questions, and so what I'm going to do is take questions, keeping in mind that we've got a presentation coming in from our police chief, who has to leave at 9:30. So if I need to, we'll stop questions.
Fire chief has to leave at 9:30. Maybe our police chief does too.
Fire chief, I'm sorry. That's right. Thank you. Our fire chief needs to leave at 9:30. So if I have to, we'll stop questions and then resume questions so that she can have that opportunity. And also, if you wouldn't mind, say your name before you speak for the benefit of the public, because they can't always see the names at the bottom. I'm going to start with the first hand that I saw, and that was Delegate Mary Lehman.
Thank you. Can you hear me? Hi, good morning, Mr. County Executive. Thank you so much for that great information, and please do extend our thanks and appreciation to the hardworking county staff. Your report was really, really impressive. Very quickly, can you clarify, because this is leading to confusion in a number of places, whether residents from outside the county can get vaccinated in Anne Arundel? I know, in some counties like Prince George's, initially they were allowing that, and now they've stopped that and are canceling appointments because so many people from outside the county were trying to get in. Also, some private systems like Doctors Hospital, which is now part of Arundel, is not saying you can't be from outside the county, but they are prioritizing Prince George's and Anne Arundel. So can you explain that?
I guess the real question is whether we're turning people away when they're not from the county. And I mean, I know we asked the question, but Dr. Kalyana Raman would probably have a better answer on the process.
Yeah, we are prioritizing people who live and work in the county. We're not turning people away in the sense that, we're taking them off the line, but we're making our access available predominantly to those who live and work in the county.
Okay, great. Thank you. Next, we'll have Delegate Sid Saab.
Thank you, Madam Chairman. I guess there has been some questions. I actually have two questions, but one of them is there has been questions or concerns about some wasted doses in respect to some of the health departments, that not enough people are showing up, or at the end of the day, after the doses have been thawed, you have to either use them or throw them away. Question is, have we had any of those issues in Anne Arundel County?
I certainly have not heard of any. And again, that would be a Dr. Kalyana question.
Yeah, we have. Yeah, we haven't had wasted doses, so that's why we have our appointment schedule, and we actually have a system that as the day goes on, we draw up fewer and fewer vaccines so that we're matching exactly the number of people who are coming.
Now, on the vaccines, what are the numbers, not the percentages? How many of the vaccine the hospitals are getting? Do you have any idea? And the pharmacies? I think some people have asked these questions, and I'm trying to get numbers, but not percentages.
Sure. So and I don't have the numbers in hand, and I can get those to you, but to date, the hospitals have gotten vaccines to vaccinate 100% of their staff. They have not gotten additional to start vaccinating the public, but they're using that extra because they didn't get 100% uptake to vaccinate the community. In terms of the pharmacies, there's two categories. One is the CVS Walgreens doing the nursing homes and assisted living facilities. We don't have a breakdown yet by county of what that looks like. So I don't have that for you. That would come to us from NDH, since that's a federal program. The second is the allotment to the commercial pharmacies to start vaccinating the public. And we expect to see what that number will be next week, but we haven't gotten that. We haven't even gotten what our allocation is for next week. So once we have that, I'll be able to share that.
The allocations that we're getting, are they, because now, obviously a lot of us are pushing for schools to reopen, and one of the main things that would help with that is having the vaccine available, and the teachers or educators are in 1B. Is there like a dedicated batch that we would be dedicating for our educators, so make sure they can go back, for the ones that choose to get the vaccine and to go back to school? Are there efforts to specifically target and get the teachers and the our school system employees vaccinated?
Yeah, so Dr. Kalyana, so what we're looking to hear from the Maryland Department of Health is whether they're going to be creating specific allocations or if they're just giving it to us county and we make those decisions. In phase 1B, we have about 40,000 people over the age of 75 and about 25,000 educators across public, private school, and childcare. So we're going to have to make decisions since we only get about the health department get about 5,000, and there's maybe another 1,000 going into the county. So that's going to take a few months to get through that at current vaccine allotment levels.
So
but that's a very good question.
Hold on one second. Oh, I'm sorry, County Exec. What I want to do, if you don't mind, since all of us are going to remain, I'd like to be respectful of Chief Wolford's time, who has said that she has to leave. So if we could just make one little quick shift to Chief Wolford, have her give her presentation, and then we will resume the Q&A. And also keep in mind that Dr. K will be making a presentation as well, and some of the questions may be answered. So I have the queue in mind, and I won't lose that queue. And please don't forget your question. And if we could now just move the agenda so that Chief Wolford can have a moment to speak. Thank you for your consideration.
Thank you so much, Delegate Bartlett. Thank you, Mr. County Executive. My apologies for having to leave at 9:30. Just in regards to COVID and what your Anne Arundel County firefighters are doing, clearly they've been on the front line since March, as many other providers in our state have been doing. This is something that we are still in our same policy area of how we are running calls and how we are dealing with what we term PUIs, those potentially under investigation. Those would be patients that call 911, that when we go to their home or their business to care for them, that we are gearing up in full PPE. We are still full eye protection, full mask protection, full body length gown, and then double gloved. So we are still running those same calls that we have been running since March. We have been doing a great job of making sure we have enough PPE. I don't feel that any of our providers have wanted or needed for anything that couldn't be provided. So we're very lucky to be in that position. We are now obviously moving into vaccination. We had the opportunity to vaccinate our public safety officials in Anne Arundel County, and really just a huge honor. We vaccinated everyone from the 2 or 3 officers that work on Gibson Island, the Crofton Police Department, FBI task force working in Anne Arundel County, the Sheriff's Department, police, volunteer firefighters, career firefighters, EMTs, you name it. If you were working in public safety, we got you into our training academy and got you vaccinated. And what my division chief had down to 1 minute and 15 seconds you would spend in the vaccination room. So it was a very well thought out process. I think the most important thing to share is the sense of pride and almost the emotional reaction from some of our officers, whether they were police officers or firefighters. Literally, some of them walking out the door saying, I feel like there's hope. Like, I feel like I might get my normal job back or my normal life back. I feel like my spouse may not have to be scared when I come home because I've had contacts with 20 patients taking them to the hospital. So we know there is this huge push and we know we need more vaccines, but please, understand that message of hope that comes with all of it. And obviously very honored that we were able to do over 2,000 public safety officials in such a short period of time. None of that would have been done without the assistance of the police department and the health department. That team there is working day and night and assisting anybody and everybody willing to help. As we move forward, we're very honored to be supporting the Anne Arundel County Public School System and taking care of all those educators and staff. We are ready to go. We're always ready to go. If I could, I would start vaccinating, in the next hour today, but we know we need to wait and make sure that we have those vaccines and that we're still, caring for our most vulnerable, that 75 and over population. So really just kudos to you, County Executive Pittman, for understanding that we're here to help and for calling on us. We're very happy to do it. The fire department is composed of 31 fire stations across Anne Arundel County, and there's about 1,500 firefighters. 1,000 of those are career firefighters, and about 500 are operational volunteers. So it is a strong workforce. I will say they are getting mentally tired. It's hard not to when you're used to just, taking a 911 call, parking in front of the home, walking in and assessing a patient and then taking them with you so you can bring them to the hospital and care for them. All of that PPE requires these additional steps, getting dressed in the front yard, making sure your gown is on appropriately, making sure that your N95 is appropriate. So I will say there is a mental toll that comes with doing it. By all means, it is what we signed up for. And we have lots of resources in place within the department. We have a peer support team that has been working 24/7. And we feel everybody's in a good place. So from the fire department to all of you, if there's anything that you need, I'm always available to each of you. And just let us know how we can help. But our next big mission will be to take care of our educators and to hopefully make our parents happy in the community and get our kids back into school. Thank you.
Thank you, Chief Wolford. Do we have any specific questions for Chief Wolford before she has to leave? I know we still have our remaining questions from the first panel, but I just want to make sure. Okay, Delegate Heather Bagnall, do you have a question for Chief Wolford? Okay, please.
Thank you, Madam Chair, and Delegate Heather Bagnall, and thank you, Chief Wolford, for all the work that you're doing. You actually partially answered my question, which is how are you managing the fatigue of your team? Because I know that this is above and beyond and a fairly constant rate of crisis. So can you speak a little bit to how you're able to manage that that fatigue, physical and mental fatigue?
We did one of the things that we altered. So majority of our fire stations have workout facilities, and in the beginning of COVID, we had limited that. Just really not understanding the virus as we do now. We're at a point that we can encourage the physical activity, encourage them getting out during their shifts, doing area familiarization, which really just puts them walking in the community. It just gets them out and exercising. They're not making people contact like they like to do. Because obviously we're asking that they don't, but it still puts them in the community in a different way. The peer support team, we have about 27 members, and our peer support, firefighters and normally police officers like to talk to their own. They seem a bit skeptical of talking to others. So we train our own firefighters and fire officers to be able to deal with some of the mental health struggles. We do have a mental health clinician that we work with. And we just kind of keep in touch. Normally it would be on what we consider bad calls, pediatric cardiac arrest, maybe a motor vehicle accident that was a little bit worse than we initially thought. But we're now sending those folks out on a more regular basis just to make contact. And we're encouraging all of that conversation. So that is one of the main areas. We have lots of resources available. It's just making sure that we continue to push those. So we're almost over communicating, I think my firefighters would say at this point.
Well, thank you so much for everything that you do, and please, look to us as a resource, because we want to support the work that you're doing.
Thank you. Delegate Saab, I did want to add in, you mentioned that question about the potential wasted doses. What we do at the clinics for the fire department is we actually have a standby list of potentially 30 people that would live within 30 minutes or less of our clinic site. So our clinic site has been our training academy. And we notify those people at the beginning of the day to say you're on call. And when you're dealing with the Pfizer vaccine, if you have enough drawn up or you have potentially too many, because maybe some clients didn't show up for their vaccination, then at the end of the day, we've been ending our clinics. We've been going 7 a.m. to 8 p.m. Then we give them a call around 7:30 and say, we have 5 more doses, you're one of the 5. So I can tell you from my point of view, there is literally not one drop that I don't feel responsible for.
Right, thank you.
Can I just add something to what the chief said on the morale question among the firefighters? That we have very good relationships with both the firefighters union and the FOP with the police union. And they did not ask for hazard pay, which was unusual. Most counties, the first responders were saying, look how much harder our job is, we should get hazard pay. And I mean, I've been criticized for, I guess, the investments that we've made in public safety we gave both police and fire good contracts this year to try to get them up to the regional average. And it costs a lot of money, and they appreciated that. And I think, so that relationship was really important. And I know that both chiefs have good relationships with their union leadership as well. And so folks just said, this is what we do. It's tough, but it's what we do.
Any other questions for our esteemed Chief Wolford? Thank you, Chief, for being here. Thank you for making the time. And we look forward to hearing more from you. And we know that you're out there working hard for us, and we really appreciate it. Thanks for being here today.
Thank you so much. It was great to see everyone.
Okay, so we're going to resume our agenda back to our list of questions, hoping that you all have not forgotten your questions. Delegate Saab, you were in the process of asking your question, and Mr. County Exec, you were responding to it. I want to know, is that still a relevant question that you have, Delegate Saab, and County Exec, did you want to, respond to it? So Delegate Saab, has your question been answered? Have all your questions been answered?
Actually, I do have a couple, more questions, and
Sure.
that I know earlier in the conversation you said, how can we do to help? And obviously, our goals are aligned with getting, teachers, educators, our system, and also the vulnerable tested. So from the state perspective, what can we do to help to get more vaccines into Anne Arundel County? Obviously, we're doing a great job not wasting any of them. and we definitely have the need. And I think we're a little bit behind some other counties as far as when we receive them. Considering the size of our county, I think we should have gotten them earlier than other counties. But from state legislature, what can we do to help so we can get more of those vaccines in?
Yeah, I think one question you asked earlier, and this is part of this, is there a separate allocation for the school systems? And I'm getting this third hand. Dr. Kalyana could probably answer better. I'm not part of the meetings with the Department of Health that the health officers have, but that's been the conversation. Is they have said, yes, there's going to be a separate allocation for schools, but there's been very little information about when, how much, how separate do we have the authority to make these decisions? So we're waiting for an answer to that question before we decide whether we have to cut in half what we're getting and say, half is going to go to seniors over 75 and the other half is going to go to educators, because we know we need to get our schools open. It's two competing interests, and we need to know where the state stands and whether or not we have a separate allocation. So it's really about information, and I'm not throwing anybody under the bus because they're not getting good information from the feds. So it's very difficult, but knowing, for them to know that we're ready to take more is part of the story that they need to hear. But we don't understand how they make their decisions about allocation.
Madam Chairman, I'm going to actually yield for now. I do have more questions for later, but I want to give the opportunity for other delegates to ask.
Very good. Thank you, Delegate Saab. Delegate Henson, you had a question?
Thank you, Madam Chairwoman. Thank you, Mr. County Executive, for the outstanding work that the team has done with the response with resources and relief for our residents and business owners as well. And thank you, Dr. Kalyana, for the information and the messaging, and for being personally available to answer questions even on weekends, as these jobs are 24/7 for probably all the people that are on this screen. I wanted to ask about the readiness to move into 1C. The governor's plan has everyone moving into 1C on the 25th. You mentioned that Anne Arundel County has over 40,000 residents that are age 75 and over. And in 1C, the vaccination would be available to residents age 65 to 74. How ready are we to move into 1C?
Well, I know Dr. K can answer that as well, and he hasn't even had a chance to do his presentation. Maybe this is part of it, but the announcement that counties can move into 1C if they have enough vaccines to do so it does raise people's expectations. But as you've heard, at 5,000 doses a week, they would be jumping ahead of the line that has been established by the state and by the CDC in terms of priority if we let them come in before we get done with our seniors and our people in 1B. So it's a wait and see based on how many vaccines we get. Is that accurate, Nilesh?
Yeah, we haven't actually finished 1A, so we still have healthcare workers that we're vaccinating. And as the county executive mentioned, opening it up to a new category doesn't get more people vaccinated. It'll just increase the pool of people who need it. And we haven't gotten the most vulnerable, those over 75 yet. And that's all a vaccine allotment issue, and it's not a capacity issue in our county.
Thank you.
Okay, next I had Delegate Kipke he was next with a question. And so I promised him that I would ask his question on his behalf. I think you just might have gotten to his question. First, he did want to thank all of, and this is a quote, all of the Anne Arundel County folks for working hard on COVID. And his question was, he wanted to know about the high-risk individuals who are not over 75. And I think that's where you were just alluding to, Dr. K and Mr. County Executive. But if you could possibly just respond to that, as well as follow up with his office, that would be greatly appreciated. So is that what you were saying before, that we haven't gotten to the most vulnerable yet?
Yeah, so that's the issue of in his office and our office have been talking about this, high risk individuals who are under the age of 65, who are in our phase 2, and that's at the state and county level. And it's challenging. We're actually working through with the state how we can identify those who are at the highest risk in that category, who we can get vaccinated. This is a framework. It's not meant to be rigid, but we also want to make sure that it's equitable. You're muted, Chair.
Delegate Bagnall had a question with respect to this group, and then we're going to move to Delegate Seth Howard has a question.
Thank you, Madam Chair. First of all, I wanted to say thank you again for your focus on low-wage workers and the arts and hospitality, because I think often these communities are just sort of forgotten in the midst of a crisis. And I was wondering, County Executive, if you could speak a little bit to the synergy between some of these programs that not only met the need for food stability, food instability and housing instability, but also the resiliency for the hotels and hospitality community, because there seemed to be a real synergy in terms of developing these programs like Feed Arundel and the hotels for the homeless. And is there anything that you foresee that we can carry over even when we're beyond this crisis, things that we've learned that might be a way to accommodate these industries in the future?
Yes, thank you, Delegate Bagnall. It's a great question because there are. And what we've learned is how to create programs that meet the needs of the people who are the most vulnerable. So the problems in our economy were there before. It's just the pandemic made it worse. And so it really is hard to make a living waiting tables. It's hard to, in fact, a lot of the people in the arts are waiting tables, as you know, to supplement income and trying to throw it all together. And an unemployment insurance system that doesn't allow those folks to even apply. So the feds have figured out how to do that. It's been slow trying to get it all implemented. But then at the local level, it's very easy for us to do business assistance, to transfer money into the account of businesses through economic development. That's something that has been a well-established practice in this country for local governments to do. What is not a well-established practice is for local governments to provide cash assistance, economic assistance to people who aren't making it when other levels of government have left holes in the safety net. So we have a better idea of where the holes are, and we've started to figure out how to fill those holes. And these programs will continue to the extent that those holes still exist. So we watch closely what the feds are doing, and as they patch them, we'll go somewhere else. But we're thrilled that unemployment insurance is now going to have the $300 a week supplement. That's going to help a lot. And our staff and our team are in the community, and and the community is speaking to us, and we have to listen to continue to adapt to the needs as they emerge. But I think for the public, it's been a positive thing that people really do understand that as a community, we have to take care of the people who are hurting. And this pandemic has showed us very clear who's hurting.
Thank you so much, County Executive. And Madam Chair, if I could ask one follow-up question related to the vaccines. The County Executive did mention that we're trying to manage expectations. So if Dr. Kalyanaraman could speak a little bit to what that looks like, because I am getting folks that are saying they signed up for an appointment, they haven't heard back from the county. Can you just speak to what that expectation should be so that we can be communicating accurate information?
Just one interruption, please. Could we, Dr. Kalyanaraman, could you hold off on that? Because he is going to make a presentation. We were trying to address our questions, if we could, to the county exec while he's here, because he also has to leave. And then Dr. K will be available to answer questions for us.
Absolutely, Madam Chair. I apologize.
No, that's fine. Thank you. Thank you, Delegate Bagnall. I'm going to move on to our last two questions, which will be Delegate Seth Howard and then Delegate Chisholm will be, that'll be it for the county executive, and then we'll move on to Dr. K's presentation.
Thank you, Madam Chair. Mr. County Executive, I understand you correctly. You support the governor's call to reopen schools on March 1st?
Yep.
Thank you for making that clear. Also, too, just very quickly, some of the private institutions for learning have been open to some extent, some fully throughout this crisis, some just coming online. So there won't be a bifurcation of allocations for vaccines between public and private school teachers, right? It'll just be teachers or teachers, and we're just going to lump them all into one group.
No, the agreement with the fire department is for only Anne Arundel County Public Schools, 14,000 folks, and the rest will go through the health department. So they'll be happening at the same time. But what we found with the fire department is that it works best to give them a clearly defined group of people like we did public safety. And so now they're taking AACPS. The others will go through the health department, but they'll be done at the same time.
Okay, thank you.
Delegate Chisholm.
Thank you, Madam Chair. My question is in regards to the administering of the vaccine at our two hospitals. So I don't know if it should be tabled for now until after Dr. K, or if Mr. County Executive wants to address. I just want to know if we know how many vaccines have been sent and administered to Anne Arundel Medical Center and to BWMC.
I think Dr. K probably, I think that question was already, you already said that we don't have that number. If I'm wrong, tell me if I'm wrong.
We don't have that number because the numbers are actually reflected as hospital systems. So we see Luminous, which is both Anne Arundel Medical Center and doctors, and then we see University of Maryland reflected as well, or at least a portion of it. But so we don't have a straight number for each of the hospitals, but we're actually meeting with them today to get an answer for that.
So you'll be able to report back to us the actual number after meeting with them?
If I have that number, I will report either way, and if I have it, I will share that.
Okay, because when we started out with the pandemic, obviously everybody's focus, rightfully so, was flatten the curve and protect the vulnerable, and especially the first responders in the hospitals. So it would be great to have those numbers. Thank you.
Thank you. Okay, we're going to move on. And Delegate Saab, I see that you had a question. If it's a question that Dr. K could answer, do you want to hold? Can you hold off?
Well, I'm going to actually, he might be able to answer, but I'm not sure fully. But I do want to ask the county executive a question. And then if he wants to defer it to Dr. K, that's fine. And it will be quick. I know there's been a big controversial issue between the 25%, the 50% with the state. And myself and many other business owners are still not convinced with your decision as far as closing the restaurants and shutting them down. And you did mention something about people waiting tables, but if there's no tables to wait, they're not going to make any money either. So it's affecting people from the top or the owners, but it's also coming down the bottom. But the question is, at what point and what is the exact metrics, and also the method that was used, and how are the question asked when it comes to contact tracing that led to believe that restaurants are the biggest super spreaders? And also I want to touch on the sports activities. There were some, and Dr. K and I had, conversations about like ice rinks and roller skating arenas where you only allowed 20 people, but yet you allowed 160 people to actually as employees. So the question is, I would like to see, in the name of transparency and government transparency, how are the questions asked and exactly what is the science behind it? Because honestly, people need to know exactly the science that is tied to the livelihoods.
Well, there are two questions there. One is, what is the metric that we go by? And the other is, what does the science say? And the metric that we go by is, as you know, from federal and state and every county in this state, that there's no single metric because things change. So with the vaccinations coming on, that changed the metric drastically for opening schools. It went from 10 to now it's going to be a much higher number. I was looking, and I said at the time, particularly at the hospitalization projections and what we could do to push the numbers down. And the Johns Hopkins experts were saying that potentially about 20% impact by having restaurants open. Restaurants, the issue was clear that it was the only public place where people could go indoors and take off their masks among other people in the public legally. And so that's why a number of jurisdictions around the country and around the world and in this state as well closed restaurants at various times during this pandemic to push the numbers down. So we are trying to get them back to 50%. But we have to time it carefully, because we can either level off on these numbers or we can push them down enough that they actually drop. And right now we're at the point where death rates are as high as they've been, and we don't want them to go any higher. With 25 people a week dying in our county, it's worth really doing something that might have a 20% impact on the numbers. But as you know, it's a new pandemic, and the metrics are being adjusted by the scientists all the time, and based on the new information that they get. And they've gotten a lot of new information on school openings. So we have to keep listening to all of the sources and make the best decisions that we can based on all of the sources of information that we have, and be willing to change our mind when the data changes. And so I can't give you a definitive number. We spent about 8 hours talking about this in court, and it was a very eye-opening process for those who participated. And I think we came out of there, it was clear that restaurants do spread the virus. It's a high-risk activity to do indoor dining. And we could debate that, and I'm sure we will. And I sat down with James King after the lawsuit, and we talked about it, and we're going to work together to rebuild the industry. And that's what really matters.
Okay, so we're going to close questions for Mr. County Executive. Thank you, Delegate Saab, for your questions. And I just wanted to share with the public, because you can't see what's in the chat, but there have been many members who are thanking Anne Arundel County for your work. And so this has been, it's been such a learning experience for many of us. And I feel that Anne Arundel County is doing a great job of stepping up. And thank you for the work that you do. So now we're going to move on. Thank you, Mr. County Executive, for being here. His members of his staff, Mr. Pete Barron and Mr. Chris Trumbauer, will remain to answer any further questions if you all have any. So just keep that in mind. We're going to move.
I'm going to run, but I'm still going to be listening as I travel. So
very good. All righty.
Thanks.
Thank you. Okay. Bye-bye. Okay, so we're going to move on to the presentation that Dr. K has, and he actually has a slide presentation that he is going to share with us. It may answer or be somewhat repetitive because we have had such a robust discussion already about COVID-19, but hopefully it will either reinforce some of the information that was shared, or we will learn new information. So Dr. K, you have the screen.
Thank you, Chairwoman. It's always tough to follow the county executive. He actually listens to everything very closely. And so he usually does about 75% of my presentation by himself anyway. So give me a second. And I'm going to move very quickly through these, and I'm happy to make these available, after the meeting. And so
if you could do that, that would be great. If you could make them available.
And actually, some of this material I included specifically just to make it available in print afterwards, and I don't really think we need to linger too long. I always like to start with our principles, which is to eliminate the virus, keep people healthy, allow schools to open, and we've been saying that since the summer, and keep businesses open, and doing that through to promote mental health and social well-being, and using public health measures as a roadmap for that recovery. So it's been a year since we've discovered it. We've had over 30,000 cases in the county, over 400 deaths. sure all of you are very familiar with this case rate curve. We're still at 45 cases per 100,000, which is a very high level, but off of our high of about 64 early last week. And so that's seeing our holiday rise come down. And we're really, at this point, really need to see over the next week or two what the effect is. Are we going to stabilize here or go down? Obviously, we want to go down. As the county executive noted, hospitalizations are kind of the key. We've seen for the past week, finally, that we've seen hospitalizations level off, which is critical. We are straining our hospitals, but they can manage if we can keep it at this level or ideally bring it down. But they don't have a lot of slack left. They've already had to pull in staff from other areas to work these extra beds. This is our occupancy, hospitalizations in the state. Like I said, you'll have all of this. And I think a key measure is our seroprevalence. This is measure based on antibody testing that the CDC does to give us a sense of how many people have been infected. So it goes beyond just testing, which tells you if you've been infected recently. And their estimates are about 10% of people in Maryland have had this. So these are the effects in terms of deaths and illness from just 10% of people having this infection in the past year. And this is the reason that we have spent all this time and effort. Is if we had let this go much further, it would be much worse scenes that we see in LA, in El Paso, and the Dakotas over the summer. And this is our deaths, which is what we've been seeing in the past month and a half, about an average of 20 deaths a week. So about 3 a day, which is obviously a very high rate. I just wanted to give you a scene of where we were in terms of our metrics and then really focus on the vaccines. Starting with, how do these two vaccines work? These two vaccines, the Pfizer and the Moderna vaccines, they're mRNA vaccines. mRNA is the instructions to your body to create proteins. All of you have seen the picture of coronavirus with those red spikes. These instructions tell your body to make those spikes. Your body sees them and says, this is foreign, and builds antibodies to them. And that's how you gain immunity. What's interesting about this is that your body then destroys those mRNA instructions. So there's no actual virus being put into your body, and there's nothing that's left of the vaccine after a few days. The best way to think of the mRNA is as those IKEA instructions. Once you use them, you toss them. And that's what your body is doing. Uses it, makes the proteins, tosses the instructions. So this vaccine was developed in the course of a year, but it's built on decades of research. So mRNA vaccines have been in development for decades. Coronaviruses have been studied for decades. COVID is just one of a member of the family of coronaviruses, common colds, MERS, SARS. So when COVID came to the forefront, all of this effort was brought together in a massive global coordination. And that's how we have seen researchers and scientists develop and implement a vaccine in a year. And it's also involved broad recruitment into these vaccine trials at levels that we really don't see otherwise. Both of these vaccines that have been approved are under emergency use authorization, but they are also 95% efficacy, which is pretty impressive. For comparison, flu vaccines are about 40 to 60% effective. Also importantly, there was significant minority enrollment for both vaccine trials. All the discussions that we've had over lack of representation in vaccine trials and in healthcare were used to inform vaccine trial enrollment. And so we saw 9% of vaccine trial participants were African American, 20 to 26% were Hispanic, which is much greater than in previous trials. And most importantly, both the efficacy and the side effects were the same in both of those groups compared to the general population. Side effects are common, but they're generally minor, and they're more severe with the second dose, and even including some chills. But serious side effects are rare. The two vaccines, Pfizer and Moderna. Pfizer is 2 shots 3 weeks apart. Moderna is 2 shots 4 weeks apart. And what we see is that the first shot gives you a partial effect, and you really need that second shot to provide the full benefit of the vaccine. So this is probably the part people want to know the most about right now, which is the phases. I want to start by saying we use the honor system. We're asking people not to jump the line and to stay within their phase. We're the health department. We're not good at policing things. We're not trying to police things. And frankly, we want to get shots in arms. So we really need everybody's help. I know it's hard. I know everybody wants it. Please stay in your phase. These prioritizations were developed by the CDC and balancing two different but important considerations. One is individual risk, and we'll see that going along. And then one is also groups that are essential for societal functioning. And recognizing that each of those are valid reasons to vaccinate groups and certain workers, and the prioritization blends that. Our prioritization in the county is based on the Maryland Department of Health and is roughly in line with what the CDC does. It's actually stretched out a little bit more to provide a little bit more granularity. Phase 1A, we're still in phase 1A. It started in December. Healthcare workers, public health, nursing homes, first responders, judiciary, and corrections. And really what's left for the first dose is healthcare workers. There's still in excess of 10,000 healthcare workers who need to be vaccinated. All the other groups are by and large have gotten, anybody who wants it have gotten the first dose. And we'll be moving into the second doses shortly. Last week, we also moved into we announced a move into phase 1B, into 75 plus, particularly for two reasons. One, we were having to put more and more effort into getting those healthcare workers. And second, I think more importantly, just the rate of deaths. We were seeing such high death level, we really needed to get to that really vulnerable group. And so we opened it up to 75 plus, and the governor's announcement came just a short while later. The CVS and Walgreens is through a federal contract are doing the congregate living, and so they're moving into assisted living and group homes. And then at the health department, we are working with senior housing and homeless shelters to get people in those settings vaccinated as well. So those are some of our most vulnerable residents in the community. The other piece of phase 1B is education, school teachers and staff, both public and private, and childcare. In the first group of individual risk, there's about 40,000 people over the age of 75, and then there's probably a few thousand more in those other four categories. For the educator group, there's about 25,000 people. So we're talking about 65,000 people total eligible in phase 1B. And at current allocation levels of about 5,000 doses a week, it's going to take us the better part of 2 to 3 months to get through everybody in these phases. Now we're capable of ramping up our operations, and we are working with partners in the community who are also capable of ramping that up. But right now, the choke point is the vaccine supply coming into the county. We talked briefly about phase 1C, the governor saying that the counties could go into phase 1C for the age 65 to 74 starting on Monday. We're not doing that because we haven't gotten through the most vulnerable people in phase 1B yet. Opening up to phase 1C wouldn't get more people vaccinated. It would divert us from getting the most vulnerable vaccinated immediately. So we are going to make those decisions on a week-by-week basis. Once we see a drop in vaccine interest amongst that 75 plus, that's our signal to open it up to the 65 to 74 group. And then within this group is also the frontline essential workers, people who have been working throughout the pandemic without the ability to take off, distant, work remotely, and oftentimes having interactions with the public as well. People who we've talked about being generally in the lower wage workers as well fit into this category. And then phase 2 is our 16 to 64 with high risk conditions and essential workers. And we don't anticipate starting this group until April, and obviously vaccine availability, that's 3 months out, and vaccine availability will determine whether that can happen sooner or will have to happen later. These dates are all estimates based on current vaccine allocation levels. And then lastly is phase 3, just all adults age 16 to 64. There is no category for children 15 and younger because there is no approved vaccine yet for them. Trials are ongoing, and we expect to hear more in the summertime as to what that looks like for anybody under the age of 15. Get your shot. We encourage everybody to pre-register, preferably online, but we also have phone pre-registration available, and so available in multiple languages. it's really important to recognize that that pre-registration tells us if you're interested. It doesn't mean that you're going to get a vaccine slot next week. We're only sending appointment invites to people in phase 1A and seniors in phase 1B at this time. And even that, it's not to everybody in those two groups because we just don't have enough slots. We've got over 20,000 people pre-registered in those two, and we only have 5,000 slots next week. I know it's frustrating. We are ready to ramp up, but I just want to, I want to share that and ask for people's patience as we move through this. We've been partnering with a variety of organizations in the community, the two hospitals, Anne Arundel Medical Center, Baltimore Washington Medical Center, and I mentioned to Delegate Chisholm that we have a meeting with them on vaccination specifically today. I'm not in that meeting, but my staff are. Our federally qualified health centers, giant pharmacies are going to start vaccinating the public today, not today, sorry, soon, probably next week. We're waiting to hear when they're going to get an allocation. Those allocations come from the Maryland Department of Health. We don't do those allocations as a county health department, and that's how it's operating at the state level. So that's why I'm not able to tell you those details at this time until I know them. And then, of course, the fire department has been a fantastic partner and has been critical in getting vaccines into the arms of first responders and soon AACPS. And then CVS and Walgreens, and I mentioned that their role in congregate living facilities. Specifically for the health department, we have a couple of sites, Anne Arundel Community College, Maryland Live, Bay Meadow and Glen Burnie. We were using that for a couple of weeks. We're going to stand it back up again in about a week or two once we start doing second doses. And we're going to be starting at the Naval Academy Stadium as well in a few weeks. And lastly, and I think most importantly, we've been doing our pop-up testing in various locations throughout the county. And we're going to be doing that with our vaccinations as well with our mobile clinic. And so that'll be coming soon as well. The numbers are important. The state gets a little over 70,000 vaccines a week. We as a county county health department get about 5,000 of those. That supplies only enough for 1.1 to 1.25% of the population each week. So if you do the math, that means at current allocation levels, we'd only get 50% of the population. Now we know that there's going to be increased production and that there's going to be new vaccines approved. So once we see the effects of those, we can update these estimates. But right now, that's the trajectory we're on. And the way we're operating as a health department, we're doing 5,000 first doses. We're going to have the capacity to do 10,000 doses split between first and second doses in February once those second doses come due. And I'm sure we've all seen those metrics saying, what percentage of the vaccines have the health departments used? The way we operate is we get our vaccine supply somewhere between Tuesday to Thursday. We then open up the vaccine slots for the following week, and we use that full allocation. So pretty much the time from getting the vaccine to time to using the last dose of that vaccine shipment is about 9 days. And we have to do that mainly so that we can plan our vaccine clinics. So know that we are using 100% of our doses, and the longest turnaround time is 9 days, but the shortest is about 2 to 3 days. So we get the vaccine, we plan on our clinics, we use them over the next week. In terms of staffing, we've been using our school health and disease prevention staff. We're hiring 120 new staff for vaccination efforts. Right now, all our vaccine efforts are based on pulling people from other activities. There still haven't been federal funds appropriated or distributed for vaccine distribution. All health departments are doing this with existing staff on top of managing contact tracing, on top of managing testing, on top of managing enforcement. I want to take this opportunity to just thank everybody at the health department for their hard work. I know that it's been a dead sprint for a marathon for about 10.5 months now, and it's still going. We're partnering, as I mentioned, with the fire department, with the Department of Aging, with the hospitals, and we're exploring other partnerships with insurers, with private providers, with others in the community. And then you'll see on our website, we have a vaccine dashboard that's updated every day. This is yesterday's dashboard, so I'm sure there's a new one up by today. In the county, we've had 23,000 vaccines delivered, 21,000 first doses, and the health department has done 10,000 of those. So we're doing about 50% of them. We'd ideally like to be a smaller proportion of that. We want to see vaccine in more providers' hands so that it can more easily get to everybody in the county. So with that, I'm going to end here, and I'm sure there are many questions.
Thank you, Dr. K. I appreciate your presentation and information, and also your willingness to answer questions previously. I just wanted to make a quick announcement that we have members who have dual duty and represent 2 counties, both Anne Arundel and Prince George's County. So those members had to leave, and so they are no longer on the in the meeting. With that said, I would mention that Delegate Jocelyn Pena-Melnick had a question, but I think she'll just reach out to your office with that particular question. So for our lineup of questions as it stands now, we have Delegate Heather Bagnall and then Delegate Dana Jones. Delegate Bagnall.
Thank you, Madam Chair, and thank you, Dr. Kalyanaraman, for all of your hard work and the entire staff of the Health Department. You partially answered my first question, which was managing those expectations, because obviously we're often the first line of communication and we're trying to get out good information. It sounds like, if I'm reading the numbers correctly, that the pre-registration, they may not hear about their appointment times for 2 to 3 weeks. Is that accurate?
Yes. So we're going to be sending out a weekly update, but even if it's your phase, it may take a number of weeks for you to actually get an appointment. We don't want to send out 20,000 invites for 5 slots. That just creates more frustration. And I know there's frustration either way.
And just to be accurate, they won't hear from the department until there is an opportunity for an appointment sign up. So just because they've set up and they've registered, it's not going to be like an immediate you're in the queue.
Yeah, that's correct, because we don't really know the size of the queue. It's all dependent on vaccine allotment.
Thank you. And just one quick question, because I am a little concerned about sort of a wild west scenario similar to what we had early in COVID with the PPE, with Giant in conflict with the health department. Is your appointment process in any way aligned with the process with Giant, or is it completely independent?
So it's independent right now. We're reaching out to them to understand how they're going to be making these appointments and understanding it. I think probably the best way to compare this is testing. As testing matured, there were just many options to get tested, and that's where ultimately we'd like to end up with vaccinations, but that's a while away. So we're looking to reach out to them, and they're going to be. Our understanding is, from the state, is that they're going to be focused on the seniors.
Okay, thank you. Thank you very much.
Delegate Jones.
Thank you, Chairwoman. Thank you, Doctor, so much. I do have 2 questions, but just quickly, I have to say that even on a walk with my son for recess during the day, I have neighbors who shout out to say, I just watched the doctor on a forward-facing Facebook Live or something. I'm so happy he is here. Please tell him thank you. I get that routinely, so I wanted to pass that along. So I thank you as well. I got a very specific question, and this could be expanded broader. I understand that it will be quite a while for us to get through our phases because of the actual supply. The question that I had was from a summer camp worker. And now this young woman is only 17, but I know many of our summer camps throughout the summer really relies on those 17, 18, 19-year-old college age folks. Does that fall under childcare? How are we handling that? And I understand that is far out, but do we have any kind of idea as to how we're going to handle that?
So I can tell you that last summer that we handled those summer camps, day camps under kind of the childcare framework, just in terms of like the COVID measures and oversight of that. In terms of vaccines.
Well, this would be vaccines. I apologize. Vaccines, to receive the vaccines in order for childcare purposes in camps.
No, I understand. I was just saying that I was just starting off by saying that that's how we handled it last summer, is as a childcare, under that childcare framework. But it is a little early at this point to say where they're going to fall for the vaccination piece, just because it's too many months out from that point. I just don't know what our allotment will have for that.
I will communicate that. Thank you. And then I'm not sure if we have any data on this. Do you know, as far as folks who, and this has been brought up in a few different ways, folks who kind of sign up for their interest, but potentially aren't maybe showing up or saying no thank you in nursing homes or anything. Do we have any on folks who are taking a pass? And is that affecting how we move through the phases?
We were having some significant no-show issues last week, which is part of the reason why we moved into the phase 1B 75. And when we opened it up, all the appointments were pretty much taken up very quickly. I think the pre-registration is helping a lot with that. It's a way for people to express interest. And so much more motivated group of people who are going to sign up for those appointments. So I think we're in a much better place on that.
Thank you so much.
Great, thanks, Dana. Thanks, Delegate Dana Jones. Good to see you. Okay, so we are going to, I don't think we have any other questions. Dr. K, I think you have done a fabulous job answering our questions, both during the earlier panel and now. So thank you for the slides. If you would make those available, that would be awesome. So we're going to move on with our agenda to our patient police chief, Chief Awad. And thank you so much for staying with us and making yourself available to us this morning. So Chief, the floor is yours.
Good morning, everyone. Patience is a virtue, right? Madam Chair Bartlett, thank you for the opportunity to introduce myself and address this esteemed delegation this morning. And I really want to thank you all for your service to the community. Oftentimes we don't pause to say thank you, so thank you. Just a little bit about myself. I began my professional career in law enforcement as a Prince George's County police officer in 1990. I retired in 2013 at the rank of major. I had the opportunity to serve as a district commander of the Bowie Station, in addition to serving in the capacities as an executive officer to both the chief and the assistant chief. So I had enough experience in the rooms amongst larger agency police chiefs. In 2013, that very same year, I was asked to join the Anne Arundel County Police Department as then Police Chief Kevin Davis's chief of staff. I enjoyed my time here, got to know a lot of the command staff and officers here. And so it was very humbling to come full circle after leaving Hyattsville. I'd been in Hyattsville for almost just shy of 4 years as the chief of police for 2 years. But again, it was humbling to return full circle to such a well-respected police department. And in my short time here, I've had the opportunity to meet many of our community members and many of our officers, whether by Zoom, our new normal, or in person, practicing safe social distancing. But I've had enough opportunities to really just be able to sit down and talk to folks. And I enjoy doing that. I believe in community policing. In addition to fighting crime, I believe community policing is integral in our mission, and that it's core beyond the problem solving is connecting with people and really building those relationships. So I'm looking forward to doing that here in Anne Arundel with you. Enough about me. I'd like to talk about a couple occasions where I've been present to witness the professionalism and the dedication of our police officers. And I'll begin with the events that unfolded after the attack on our nation, on our United States Capitol and our democracy. Since then, and even prior to then, federal, state, and local law enforcement partners across the country have been monitoring chatter and communications on various platforms, but specifically preparing for Sunday once threats were made that armed demonstrators would be descending on our states, our 50 states, capitals. So we in Anne Arundel County were in a position of preparedness with our federal, state, and local law enforcement partners. And a contingency of our officers were mobilized in Annapolis to protect our state's institutions in tandem with protecting constitutional rights of individuals to peacefully demonstrate. And I'm proud to report that no demonstrators or counter demonstrators were present in Annapolis on Sunday. And many of our officers, again, and command staff were present, to include myself, just to ensure that that we kept our institutions and our people safe. On Wednesday, a contingency of our officers responded to Washington, D.C. They staged here at 1:30 in the morning to prepare to go to D.C. The Washington Metropolitan Police Department every 4 years asks local and national police departments across the nation to assist with the inauguration of the President of the United States. And this year was unique in that our officers were not only assigned to the United States Capitol in Washington, D.C., but we were also assigned and staged at our State House here in Annapolis. As a result, again, of the unfortunate attack that occurred on January 6th. So our officers represented our agency with pride and professionalism, protecting the procession route along Constitution Avenue and Pennsylvania Avenue, as the president and vice president were escorted both to and from the United States Capitol. It was a long, cold, historic assignment that they honorably fulfilled without hesitation. And we made sure that they had adequate breaks, adequate meals, and we all had an opportunity to really get to talk and know one another in a formal but informal setting. And if you will, I have a couple incidents that I'd like to share with you, again, just to show you the commitment of our officers to community and safeguarding our community. So recently, last week, we had a robbery, a commercial robbery at the Krispy Kreme on Route 3. And the suspect implied as if he had a weapon. I believe it was the manager who was accosted, and the suspect, made away with, proceeds from the business. Well, just earlier this week, we encourage our officers not only to proactively patrol residential and business communities, but we encourage them to get out and conduct foot patrols, and they do. And on this occasion, it was the midnight shift. One of our officers was checking on the businesses in the area of Arundel Mills Boulevard and came upon the Dunkin' Donuts, saw that the front door was shattered, called for additional units to help set up a perimeter, and the suspect was still inside. Well, lo and behold, they were able to negotiate the suspect out, get him into custody safely, and this same individual matched the description of the individual who held the manager at the Krispy Kreme a week prior at gunpoint. So this just speaks to their situational awareness, paying attention to what is going on, not just in the moment as they're patrolling, but they're keeping track of incidents that have occurred, weeks prior, and they were able to successfully bring a suspect into custody. So that should help bring some relief to members in our business community. One other thing I'd like to highlight, coming to Anne Arundel and being a local public safety partner, I myself have reached out to Anne Arundel prior to even applying for this position regarding the crisis response team that we have here. And as you well know, we are internationally recognized by Crisis Intervention, the Crisis Intervention Team International, as the Crisis Response Team of the Year. That's how well Anne Arundel County does crisis response and mobile crisis response and peer support. And I know for a fact that other jurisdictions within the state have reached out to Anne Arundel to learn from our crisis response team, our framework and how we operate, and have asked if we will help them establish too their own crisis response teams. That speaks volumes to the commitment and ingenuity that we possess here within the Anne Arundel County Police Department. I'm just humbled and so proud to serve as their chief of police. And then the last thing I'd like to acknowledge is our health department and our fire department with not only assisting our department with COVID-19 testing, but also with the vaccinations. I know that was a tall order, and they seamlessly administered vaccinations to more than half of this department, a vast majority of this department. And again, I know that was a lot of work. There are jurisdictions who are having challenges with doing what Anne Arundel seemed to so seamlessly accomplish in a very short period of time. And that speaks again volumes to their commitment level and their professionalism. And we're preparing now for our second dosage in late January and early February. And I'll be sitting there to get my shot. And I encourage everyone else to do just that. If you've not and you are in those categories, get the shot. Thank you for your time.
Thank you, Police Chief Awad. I appreciate you being here. I don't know if we have any questions for our police chief, do we? Okay, I'm going to close the floor on questions. Thank you very much. That just shows how well your presentation was and gave us everything we needed. But we will be in touch with you, and thank you again for being here today.
Thank you all. You all have a great remainder of your session.
Okay, we just have a few more items really quickly that I wanted to go over. And I wanted to give a couple of words of thanks to a few people who are behind the scenes. I wanted to thank our delegation secretary, Sienna Scott, for making this meeting happen. I'd also like to thank my chief of staff, Mitzi Bernard, and intern Ryan Carrington, who are backup this morning. And we have a special backup from Vice Chair Rogers' office. Nicole Butler is helping us as well. So, this is all what's going on behind the scenes, and we very much need, and appreciate our staff as we all do. Also wanted to give thanks to Senators Bidle and Elfreth, who were here earlier, and I appreciate them being able to take the time out to join us. And I wasn't able to make that announcement before. So if anyone has any other any announcements or any matters that they'd like for us to discuss, I am ready to entertain a motion to adjourn.
So moved.
Second.
Second.
Thank you. We are adjourned.
Thank you. Good